more recent data we get tends to be of higher quality. And I'll give an example here of Bangladesh, which was one of those really high performing countries where they've had the questions in standard household surveys, but they've gone a step further and actually fielded specific hygiene surveys that focus on hand hygiene in different settings. And we've had the opportunity to interact with them as they develop and modify those questionnaires and analyze the results that come out. So definitely in Bangladesh, they're definitely investing resources in improving these things and in monitoring them to make sure that they can track progress. Maybe a flip side is an area where we have difficulties is high income countries, because they don't have those household surveys, and they get really upset with us actually when the reports come out and there's like insufficient data from Sweden, for example. So we have a lot of difficult conversations because we do believe that, you know, coverage is high in those countries, but it's not necessarily universal. And we do have examples from medium and high income countries that do show that there are populations left behind. We could think about the homeless, we could think about just the poor in general. So we're still trying to further improve those methods so that we can have more data from countries that don't necessarily rely on household surveys. But definitely this is an area where countries are very interested and we get a lot of engagement around.
Thanks so much, Rick, and thanks for also answering the technical questions in the chat. Quick one to Joe before going to Robert. And Joe, there was, I mean, it was a really kind of, comprehensive illustration of some of the costs at global level, and we'll get maybe the country costs through the tool. But the question I think to you was, you know, how are we going to finance this, and what is there a role for UNICEF and WHO or others in financing this? And I just wondered if you had any brief thoughts about that before turning to Robert.
Sure. Well, it's a good question, and I think it's been interesting kind of talking about that global price tag with a few colleagues and with a few country colleagues, and you know, what does that look like if you're looking at the higher estimate at 4.7% of health expenditure? It's high, and that's not even the whole of WASH. I think it's important to think about, and I touched on this a little bit in my slide. Where should we be directing our attention, and how can we use existing data sets that we have to understand where we can get bigger bang for our buck? So I think there's going to have to be a high level of prioritization, most likely, in these countries. But the second point, I suppose, is how do we finance this? Well, probably if we change the narrative slightly. You know, I just heard myself speaking there. Well, this is a basic good. This is something that everyone should have access to, and I think we need to do a little bit more work in creating a strong economic argument on the return on investment for countries of investing, and ensuring that whether households are financing it ultimately or not, that every household has somewhere to wash their hands and the means to do it. I think that's probably the most important thing now to think about. So I haven't really answered your question in terms of who, or in terms of the role for UNICEF and for WHO in particular. I think that there's a lot more work that we can be doing to ensure that the budgets and the expenditure are being tracked appropriately, and to support governments in being able to do that, so that they can look at their own budgets and work out what's missing there.
Thanks so much, Joe. I think that's the question that will go into a collective question for all of us going into the breakout sessions. And okay, and thank you so much, Robert, for your patience with that. And I know you've really learned a lot with the COVID-19 hygiene hub and all your research at the London School. So it'd be really fantastic to kind of get a glimpse of what we know and what we don't know. So over to you.
Thanks, Bruce. Hi, everyone. Again, Robert Dragolis. I'm an associate professor at the London School of Hygiene and Tropical Medicine. Most of my work is on hygiene and hygiene behavior change. I'm also the director of the COVID-19 Hygiene Hub, where we've been providing technical support around hygiene programming related to COVID-19. Next, I'm going to talk briefly about kind of what we do know and what we don't know around hand hygiene. Given my background, this is a bit of a slant towards hygiene behavior change. And and really just trying to kind of focus on some of the highlights in our knowledge gaps. So what we do know is, hopefully by now, and what's come across from other sessions, that we know that knowledge and disease risk are not the only determinant of hygiene behaviors. We know that norms are very important, things like kind of fear, nurture, there's a variety of emotional drivers here. And we hope that this has been something that's been kind of so repeated over time that we think that hopefully we're kind of seeing that this has become standard, that this is not the only thing we need to focus on when it comes to hygiene behavior change. Next slide, please. But we also have seen, and COVID-19 has become a really good example of the fact that the things that determine our hygiene behaviors can change quite rapidly, and they can change over time and space. Think a little bit about your own behaviors as it relates to COVID-19. When the pandemic started, we all, I mean, I'll speak for myself, started washing our hands probably a lot more than we did before. I remember running around central London trying to find hand sanitizer. It became, hand hygiene became very important. Over time, now that we're in this kind of new normal period of kind of sustained pandemic, the edge, that fear is waned a little bit. So kind of the drivers around that, and I'm noticing, now when I go into work, I'm not using the automatic hand sanitizers quite as much as I was before. So we can see these determinants even within our own lives are changing. And that's very universal, even outside of kind of a pandemic context. Next slide, please. We also know that access to soap and water or some kind of cleansing agent is a critical necessity for hand hygiene. As Rick was talking about with our measurements of who has access to basic facilities is included in a lot of those cost estimates that Joanna discussed earlier, we know that this is a fundamental part of ensuring adequate hand hygiene. Next slide, please. But we also know that it kind of through recent studies, and this is also, I think, something coming a little bit more mainstream, is that we know we can use these supplies and this infrastructure in creative ways to make it part of a behavior change process and make sure that we're kind of fostering the development of new habits and new norms around hand hygiene. We've seen things like nudges, kind of innovative soap approaches, various ways that we can make infrastructure part of how we're changing behavior, not just necessarily what would be kind of enablement of behavior change. Next slide. So kind of when I talk now about some of the knowledge gaps, and just to kind of give some context to this, as part of the COVID-19 Hygiene Hub and in partnership with WHO and UNICEF and the broader Hand Hygiene for All initiative, we're working on a mapping project of existing hand hygiene literature. So far, we're focusing primarily on systematic reviews and scoping reviews, and we've identified 75 reviews that discuss hand hygiene in domestic context. Over half of these reviews really do focus on the relationships between the links between hand hygiene interventions and health outcomes. These are just some examples here that I could find easily and put a kind of copy of the PDF here. So where we're really focused our attention from kind of the systematic literature is can hand hygiene interventions improve health outcomes? Now we can quibble about any of these data points, we can unpack them, some of them are very context dependent, but overall we do see a general trend that hand hygiene is important for a wide range of health outcomes, and this is well established in the literature. Next slide, please. What we don't tend to do is think through this causal pathway between interventions and health outcomes. We need to understand our interventions are going to be doing something to kind of, thinking about kind of what we normally call the software component of an intervention. How do interventions change knowledge? How do they change attitudes, beliefs, kind of everything that goes on in people's heads? We don't necessarily articulate how interventions are changing infrastructure or supplies. We rarely describe how any of these then result in changes in behavior. And then we don't necessarily look at kind of the changes in behaviors as they relate to health outcomes. I'm going to go through some of these relationships a bit more in terms of articulating there's an absence of literature here. Next slide, please. So we think about kind of hand hygiene interventions across the sector, and I think we all suffer from this, is that interventions are often poorly or inconsistently described. It's often we did a hand hygiene intervention, but we really don't necessarily provide the data that we have on what the specific activities were, how they were delivered, how often they were delivered. And we often kind of lump hand hygiene in as part of a broad package of interventions. Now, this isn't necessarily a bad thing, but when we're describing our interventions and trying to understand their impact or cost out those interventions separately as kind of important for a lot of these global estimates, we just don't necessarily have the data that really lets us necessarily work with what hand hygienes are and let us understand what is and is not more effective at changing behaviors and resulting in health impacts. Next slide. Like I said before, we have very little information about how hand hygiene interventions kind of target specific determinants of hand hygiene behaviors, whether those are psychological determinants, whether those are kind of things related to the context or kind of general environment, or the way that which interventions are targeting infrastructure and supplies. This is largely lacking. When we talk about a hygiene intervention, we often kind of leave it at that. We did a hygiene intervention without really explaining what the intermediate pathways were. This really doesn't let us really understand what parts of interventions are more effective. Which of these intermediate steps are the ones that are critical for achieving kind of a sustained behavior change and ensuring health outcomes? Next slide. Finally, when it comes to interventions, regardless of the pathways, we really are missing quite a bit of data on the intervention intensity, the frequency. You can think of those as kind of the dose that will really enable important behavior change. Now, this is ultimately incredibly critical for some of, and one reason for a lot of that uncertainty in a lot of those costing models. We don't necessarily know, do we need to have household visits in every household on a weekly basis? Is a mass media campaign, is a promotional campaign, can these work as effectively? What's the right combination of these? And this is really mission critical in order to really make sure that we have the necessary data to plan and implement these programs correctly. We don't necessarily know much about the effectiveness of different delivery channels. We can have messages, we can have posters, but how we show those to people or how we get those out to kind of our target population is very important. Do we need people going door to door with kind of community health worker volunteers, which is one popular model, versus something like a social media campaign? What's the different reach and intensity, and how do these impact our kind of end results? Finally, next slide. And when we think more about those behaviors, a lot of what we tend to do within our literature is we focus on kind of, we reduce hand hygiene down to a simple prevalence measure. Does someone practice hand hygiene versus not? And we really focus on this kind of very minor binary. Occasionally, we get a little bit more sophisticated and look at hand hygiene around critical moments, but that's very rare within the literature. What we don't know and what we haven't really systematically documented yet is how things like the timing, the duration, and the quality of hand hygiene really influence health outcomes. So there's still quite a bit of knowledge gap about this, one of the most basic human behaviors that we just don't necessarily know exactly how it should be done and under specific times. And there's various schools of thought on this. Finally, the kind of when kind of going back to hand hygiene policy, this is really the broad policy environment of kind of how we're that shapes hand hygiene interventions and ultimately health impacts. And there's really just an absence of information on hand hygiene policies and how those and what they are. Rick mentioned earlier that we've got specific countries where we've seen significant progress in terms of hand hygiene coverage for hand washing stations within the home, but we haven't really necessarily kind of deconstructed what were the policy environments in these countries that were more or less effective at leveraging change. So in summary, and hopefully kind of a next slide, please. A segue into kind of some of the breakout groups, building off some of the knowledge gaps before, is just we really do have kind of limited systematic analysis of how hand hygiene policy influences behaviors or health impact. we suffer from very inconsistent reporting of intervention components, how they target specific determinants, and the delivery mechanism for those interventions. And we really have very limited data on what the most appropriate dose is for hand hygiene interventions. And this has consequences for how we don't really necessarily always know what's going to be the most effective way to achieving universal hand hygiene. And finally, that link between hand hygiene behaviors and health impact requires further analysis and research. So, thank you.
Thanks so much, Robert. Wow, that was a sort of a tour de force as far as knowledge gaps, and thank you for kind of leading it through for us so systematically. I think what's happened is you've covered so many kind of areas that I feel like there's a little bit of shyness in the chat, and we will be going into breakout sessions shortly. But I guess I have one question for you, and I'm sorry to kind of put you on the spot with this, but if you were kind of, as a researcher and you were sort of thinking about, if you could get your hands, I guess, on any type of research kind of paper, whether it's, someone essentially describing the hand hygiene interventions a little more clearly, like generally, or a specific, topic on hand hygiene, is there anything that you feel like you would desperately want to see right now? As far as a type of paper, I hope that's okay to, yeah.
Yeah, I mean, I think a lot of this, when we look at hand hygiene and what we know and don't know, it's not necessarily kind of one data point that's really going to drive any of this. So it's not one study that's going to answer all of our questions. I think as a researcher, the parts that I think would be most important is if we could provide more information about our hand hygiene interventions, about kind of these key questions: how often, how frequent, what modalities were employed with that intervention, and how they and kind of how they were delivered. I think that's a lot of the missing gaps. We know we've got to go beyond knowledge and just teaching, but beyond that, what else can we do, and how is that going to change on context? So I think rather than one study, just a plea for everyone, kind of regardless of how they are, to provide a little bit more details on their interventions, how those are working, and what they were actually targeting there with what they're doing.
Thanks, Robert. I think that is like super clear, and that's definitely a message we're going to carry forward after this. Okay, so I think right now what I'd like to do is take everyone into breakout sessions, and I think I'm going to ask my colleague Joe, and I don't know, maybe Jenny is helping with this as well, from the London School behind the scenes, and we are magically going to be put together and transformed into smaller groups. And then you could think of all the wonderful things that you want to ask Robert and others, and hope they're in your group. But again, most of all, I'd like to make sure that you are able to express where you feel there are knowledge gaps. Okay, so let us proceed with that.
Thank you. Thank you, Bruce. And so I will now try to magic you into your breakout groups. Hopefully this will work seamlessly. And I think we've got 4 facilitators. We've got Bruce, we've got Jenny Lamb with us from the London School of Hygiene and Tropical Medicine. We've got Robert Dreibel-Biss and Rick Johnston. And so just hold tight, here we go.
Okay, we just concluded the breakout sessions, and we have 1 minute left in the session, and I apologize to anyone that just got cut off mid-sentence. So we don't really have time to kind of debrief on this, but I did, for those of you that kind of like me didn't have too many apps open, we were following this with an app, Padlet. And Joe, I don't know if you wanted to quickly give folks an idea of how that was managed and what the results were.
Sure, I can have a go just in 20 seconds, so it will be inadequate, but just to thank everyone for having a go, for engaging with it. I think it's really useful. I wasn't part of all the breakouts, so I was able to see as things popped up, and a couple of I think common themes coming out of both the presentations and of people's own thoughts around really the need to define much better what we mean by hand hygiene and understand much better what effective hand hygiene looks like. And parallel to that, what effective interventions look like, and getting into the detail really of that. So I think that was something I can see a common thread coming across there, but also this other point on what can we learn, you know, apart from that detail, what can we learn from champion countries and countries that have demonstrated really good progress, as Rick flagged in his first presentation? Can we dig deeper into what the mechanisms were for that success, whether they were from the enabling environment, political leadership, or others? So that's another theme that I've seen come across a couple. And just for lack of time, Bruce, I think I'll pass back to you, but to say that this is not just going to be left here. We will be looking at it and scrutinizing it, and we'll feed back to you as the session, but there are also other ways that this will be useful in the process of it, sort of improving how we think about it.
Fantastic, Joe. And unfortunately, we will get kicked out. But just quickly, I want to thank all of you for joining and staying with us. I want to thank the presenters. And for people that want to continue this journey, we are going to be producing WHO formal guidelines that take a look at these questions. And I just encourage you to be in touch with Joe to continue the journey. So thank you so much for this. And it was just a pleasure to talk to you. And I hope you enjoy the session. The session's now closed.
Thank you so much.